This is my presentation on emerging and re-emerging diseases, Syphilis, Complicating Pregnancy by Kaylani Hernandez. The article in discussion today is Syphilis, Complicating Pregnancy and Congenital Syphilis by Stafford and colleagues. The articles firstly addressed why this is an important topic, namely the fact that cases of congenital syphilis infection in newborns have been increasing. Unfortunately, the rates have subsequently increased among men and women of reproductive age as well as infants, and in 2021 the rate of congenital syphilis in the United States was the highest it has been in nearly 30 years, as stated by Stafford and colleagues. The article discusses how transmission can occur. Stafford and colleagues go on to explain that transmission can occur in any stage of the pregnancy and during the birth if the infant is exposed to genital syphilitic lesions. The STI guidelines of the Centers for Disease Control and Prevention, CDC, recommend repeat screening for pregnancy at 28 weeks gestation and at delivery for women who live in high prevalence areas. Women who are considered to be at increased risk for syphilis because of sex with multiple partners, sex in conjunction with drug use or transactional sex, women receiving late or no prenatal care, and women who are incarcerated or have an incarcerated partner, or have unstable housing, as said by Stafford and colleagues. Treatment of syphilis is not too elaborate or difficult. Treatment of syphilis is treated by parenteral benzathine penicillin G. Stafford and colleagues go on to further explain how the staging of the syphilis can affect the specific treatment regimen in regards to the amount of doses. A blood test can be done to look for antibodies present in the blood. Stafford and his colleagues go into much further detail about different tests and titer numbers indicating infection or treated depending on changes when tested pre-treatment and after. Infants born to mothers with syphilis should undergo non-treponemal testing and clinical evaluation for signs of congenital syphilis, as stated by Stafford and colleagues. When an infant is confirmed or highly likely to have syphilis, they are further evaluated for neurosyphilis, then receive treatment with weight-based IV penicillin. Further discussed by Stafford and colleagues is how 88% of increased congenital syphilis cases reported in 2022 occurred due to lack of timely testing, inadequate treatment, or both. One challenge noted by Stafford and colleagues is how there needs to be a diagnostic test capable of detecting the bacteria causing the infection in the newborn. Because antibodies can cross to the infants the same in the tests they use to diagnose the mother, they are not always useful in diagnosing the infant. So why is this important? Firstly, the goals of epidemiology, as stated by DeMarco and Healy-Walsh, are prevention or limit of consequences of illness. There are a lot of consequences from the infection of syphilis in pregnancy. These consequences do not just affect the mother, but they do cause different consequences to the infant as well. Stafford and colleagues discuss consequences to infants such as anemia, thrombocytopenia, osteochondritis, or hepatobiliary dysfunction, just to name a few. This article is important because due to the increasing rates of infection of syphilis in pregnancy, the amount of congenital syphilitic cases has greatly increased in recent years. This is something that is affecting public health and a cause in which a public health nurse could involve themselves to help contribute to the goal of maximizing the state of health in regards to the public. Not only is this important in reducing consequences for infants and maximizing the health of the country, but Stafford and colleagues also acknowledge there's a huge cost factor as an impact as well. Stafford and colleagues state that the effect of untreated syphilis on maternal and neonatal health outcomes is profound, with mother-to-child transmission of syphilis estimated to cost $3.6 million in disability-adjusted life years and $309 million in medical costs globally. Syphilis is very treatable. Long-term effects to an infant can be prevented with early detection and adequate treatment. So this article is important in that we can prevent or limit consequences to this illness for infants, maximize state of health in our pregnant population, and reduce healthcare costs not only in this country, which could which will certainly be beneficial, but globally as well. Why was this article selected? This article interested me as something to present about because I am a labor and delivery nurse. This is an infectious disease that can directly impact the fetus with long-term effects if not treated appropriately. One of the things I do in my job is draw an RPR, which is a syphilis antibody screening, when I am placing an IV on every admission. I also do care for those high-risk populations of pregnant people mentioned in previous slides. Due to these 3 instances of relevance in my job, I wanted to learn further information on how it affects the fetus in pregnancy and more about the long-term effects on the infants. The questions that were brought to the surface after reading this article are there any tests in other countries being researched that can diagnose P. pediculum infection at birth? Another question is, what socioeconomic barriers can public health nurses influence in order to promote either prevention or treatment of syphilis in pregnancy? And what has the research of alternative therapies for treatment of congenital syphilis and syphilis in pregnancy shown? Credibility of this article was determined by looking at credentials, backgrounds of authors, and verification of data from an outside source. This article was found on PubMed using the word syphilis and pregnancy, limiting the search to the last 5 years as well. Due to my job, I already knew syphilis was a rising problem. All 3 authors of this article are MDs, medical doctors. The final author listed, Laura H. Bachman, has an MPH as well, a master's in public health. Irene A. Stafford's background is in Department of Obstetrics and Gynecology, Division of Maternal Fetal Medicine, McGovern Medical School at UT Health Houston, Texas. Kimberly A. Warkowski's background is in the Department of Medicine, Division of Infectious Diseases, Emory University in Atlanta, Georgia. Laura H. Bachman's background is in the Division of STD Prevention, National Center for HIV, Viral Hepatitis, STD and TB Prevention, Centers for Disease Control and Prevention in Atlanta, Georgia. This article has some pretty outstanding statistics. In particular, was cases of congenital syphilis increased by 754.8% from 2012 to 2021, as stated by Stafford and colleagues. The CDC, in their Morbidity and Mortality Weekly Report posted on November 7, 2023, titled Vital Signs Missed Opportunities for Preventing Congenital Syphilis, United States 2022, highlighted some key data points that were also listed in the article being evaluated. McDonald and colleagues stated congenital syphilis cases in the United States increased 755% between 2012 and 2021. There were some other data points that were the same. This was a reference used by the article and was found on the CDC's website, thus verifying their use of accurate data. Thank you for listening, and these are my references.